Ever wonder how a seemingly insignificant speck in your blood can throw your whole system out of whack?
Hmm.
Think about a tiny mineral that impacts, well, everything from how energetic you feel to the strength of your bones,
Hmm.
even how well your kidneys filter. It's pretty amazing, these internal
It
balances.
really is.
Today, we're diving deep into a specific instance of this in the animal world, hyperphosphatemia, which is basically elevated phosphorus in the blood of dogs and cats.
That's right. And we've gathered the key information from, veterinary medicine to give you a clear understanding of this condition.
Okay.
Our goal here is to explore what hyperphosphatemia actually is, the chain of events that can cause it, why it matters for our pets' health, and sort of what it tells us about their inner workings.
So consider this your express route to being well informed on this specific topic.
Exactly.
And just to give you a quick overview of where we're headed today, we'll start with a simple definition, then explore the, well, surprisingly complex way phosphorus is regulated in the body.
Hmm.
We'll look at who's most often affected, the signs we might or maybe might not see, the various reasons it happens, how vets figure it out, and finally, what can be done.
Yeah, and we're pulling directly from medical literature, focusing on the basics, causes, signs, diagnosis, and treatment, giving you the crucial details and the science behind it.
Great. So let's get right to it. What exactly does it mean when we say an animal has hyperphosphatemia?
Okay, so simply put, hyperphosphatemia just means the level of phosphorus in the serum, that's the clear liquid part of the blood, is above a certain point.
Right.
In dogs, that threshold is greater than 5.5 milligrams per deciliter. For cats, it's a little higher, usually above 6 milligrams per deciliter.
Okay.
And these numbers, they aren't random. They signal that the normal balance of phosphorus in the body has been, well, disrupted. The key insight really is that these thresholds help identify a potential problem.
It sounds like keeping phosphorus at the right level isn't as simple as just, watching what they eat.
Oh, not at all. Phosphorus regulation is a really delicate and actually quite fascinating process. It's controlled by key hormones, especially parathyroid hormone, PTH, and vitamin D.
Right.
These hormones act like conductors leading an orchestra of organs. You've got the gut, which absorbs phosphorus from food.
Okay.
The bones, the body's main storage depot for phosphorus. The kidneys, which are absolutely essential for getting rid of any excess. And the parathyroid glands themselves, which constantly monitor calcium and phosphorus and release PTH when needed.
Like a whole feedback loop.
Exactly. Think of each of these gut, bone, kidneys, parathyroids as sections of the orchestra, all playing their part in response to PTH and vitamin D to maintain that perfect harmony of phosphorus levels. It's a whole body effort. That's the crucial takeaway.
So if this internal orchestra is playing out of tune, what are the main ways an animal can end up with too much phosphorus in their blood? Like the main breakdown?
Generally, yeah, there are three main scenarios that lead to high phosphorus. First, too much phosphorus can be absorbed from the digestive system.
Okay.
Second, phosphorus can be released too quickly from the bones into the bloodstream.
Right, from storage.
Yes. And third, and this is quite common, the kidneys might not be doing their job of filtering and removing phosphorus from the body effectively. Those are really the three primary routes to an imbalance.
Okay, that makes sense as a framework. Now, in the world of our pets, dogs and cats, who are the ones we tend to see this in, are certain ages more prone or?
Well, hyperphosphatemia can happen in any dog or cat, really, regardless of breed. However, we definitely see it more often in two main groups.
Okay.
Young, growing animals naturally have somewhat higher phosphorus levels because their bodies are actively building bone. You can think of it like their levels are temporarily higher while they're under construction, so to speak.
Makes sense.
The other common group is older animals, particularly those with kidney issues or what we call renal insufficiency.
Ah, back to the kidneys.
Exactly. It's because their kidneys are just less efficient at regulating and excreting phosphorus as they age or if they have damage. So age and kidney health are definitely key factors to keep in mind.
That ties right back in.
Yeah.
Okay, now what about the signs? If a pet has high phosphorus, what might an owner notice? Or even the vet?
Yeah, this can be a bit tricky because there aren't really specific telltale signs that just scream high phosphorus,
Right.
The signs we usually see relate more to the underlying problem that's causing the high phosphorus, or sometimes the effects of that high phosphorus on other things, like calcium levels.
Okay.
But it is helpful to think about whether the increase is sudden acute or if it's been happening over a longer period chronic.
Okay, acute versus chronic. What are the main differences in what we might actually observe then?
So, in sudden, severe cases, acute hyperphosphatemia, one of the most serious consequences is something called hypocalcemic tetany.
Hypocalcemic.
Low calcium. Exactly. High phosphorus can cause calcium levels to plummet, which leads to muscle spasms, tremors. Think of it like the muscles misfiring because that calcium balance is off.
Wow. Okay.
And in really critical situations, it can even lead to vascular collapse. It's serious stuff.
Definitely sounds like an emergency.
It can be. On the other hand, if hyperphosphatemia develops slowly, chronically, it can lead to calcification of soft tissues. Basically, calcium deposits forming in places they shouldn't, like organs. And what's really interesting, or rather problematic, is that this calcification can actually worsen things like chronic kidney failure. It creates a kind of vicious cycle.
Wow.
We might also see the development of something called tumoral calcinosis. These are actual lumps of calcium that can form under the skin.
So very different presentations. Sudden onset means potentially dramatic muscle issues, but long-term elevation leads more to tissue damage and these deposits.
Precisely. That really highlights why it's a concern, yeah.
Let's dig a bit deeper into those causes then. We talked about reduced kidney function being a big one. How does that play out in different kinds of kidney trouble?
Right. Reduced glomerular filtration rate,
Yeah.
that's the technical term for the kidneys not filtering waste from the blood efficiently, is a major reason for hyperphosphatemia.
Okay.
This can happen if there isn't enough blood flow to the kidneys, say with dehydration or heart failure. We call that pre-renal azotemia.
Pre-renal, before the kidney.
Exactly. It can also occur if the kidney tissue itself is damaged. That's renal azotemia. The problem is the kidney.
Makes sense.
And finally, if there's a blockage after the kidney in the urinary tract preventing waste, including phosphorus, from being eliminated, that's post-renal azotemia.
Post-renal after the kidney. Got it.
Yeah. So whether it's a sort of plumbing issue, getting blood to the kidney damages the filter itself, or a blockage getting waste out, if the kidneys aren't working well, phosphorus can build up. The key insight is really that any problem affecting kidney filtration can potentially impact phosphorus levels.
You also mentioned excessive bone breakdown as a cause. That sounds a little counterintuitive. Wouldn't that release calcium too?
That's a really smart observation. And yes, bones contain both, but certain situations can tip the scale towards phosphorus release being the dominant issue, or at least contributing significantly to high blood levels. For example, like we said, young growing dogs have more bone turnover naturally. Usually normal, but it means phosphorus might be a bit higher during that phase.
Right.
More concerning are conditions like hypoparathyroidism. Here, low PTH leads to low calcium, and sometimes the body's response kind of indirectly increases phosphorus.
Interesting.
Other factors include too much growth hormone, what's called hypersomatotropism, and conditions that directly break down bone, like osteolysis or even bone loss from just not using the limb disuse osteoporosis, and of course, bone cancer, osseous neoplasia.
So lots of bone-related things, even if calcium is also involved.
Correct. These specific issues can lead to increased phosphorus in the blood.
Okay. And the third main way was excessive absorption from the gut. How might our pets absorb too much phosphorus?
Well, several things can contribute here. In cats, an overactive thyroid gland hyperthyroidism can sometimes increase phosphorus absorption.
Okay.
A really, really important point for pet owners and vets, too, is the risk associated with phosphorus-containing enemas, especially in smaller animals like cats.
Enemas? Really?
Yes, they can be easily absorbed through the colon and cause a significant, sometimes dangerous spike in phosphorus levels. It's a known risk factor.
Good to know.
Also, vitamin D toxicity, whether that's from, say, getting into certain types of rat poison that contain vitamin D-like substances or even just way too much supplementation.
Right.
Vitamin D increases the absorption of both calcium and phosphorus from the gut and can also mobilize them from bone. Giving too much phosphorus as a dietary supplement obviously can lead to higher levels too. And finally, there's a condition called nutritional secondary hyperparathyroidism. This happens when the diet has an imbalance, like not enough calcium relative to the phosphorus. This triggers hormonal responses that ultimately increase phosphorus absorption, trying to compensate.
So it's trying to fix one problem but creates another?
Kind of, yeah. The key takeaway here is that what goes in diet, medications, supplements, toxins can definitely affect phosphorus levels.
Okay. So with all these potential causes, are there any specific red flags that might make a vet particularly concerned about hyperphosphatemia, like warning signs?
Absolutely. As we sort of touched on, if an animal already has diagnosed kidney disease, that's a major red flag. Their phosphorus levels will likely be monitored very closely anyway.
Right.
And as we just emphasized, the history of using a phosphorus-containing enema, especially in a small cat or dog, should always ring alarm bells. That's a big risk. Those are definite situations where vets are going to be particularly vigilant about checking phosphorus.
Got it. Okay, so a vet suspects hyperphosphatemia. How do they go about confirming it and figuring out the underlying reason? You said it sounds like a puzzle.
It often is a diagnostic puzzle, yeah, which is why a careful, systematic approach is really crucial. The first step is always to consider other conditions that might look similar, what we call differential diagnoses.
Okay, rule things out.
Exactly. For instance, low calcium from hyperparathyroidism can also cause those muscle spasms we talked about. Dehydration can cause general signs that might mimic kidney issues initially. Of course, we need to consider if the kidneys themselves are the primary problem, renal insufficiency. We also have to remember, are we dealing with a young, growing animal where higher levels are expected?
Right. Context matters.
Hugely. A history of maybe getting into vitamin D supplements or rodenticide, or looking at the diet, does it suggest a calcium-phosphorus imbalance? These historical clues are vital. In cats, you absolutely have to think about hyperthyroidism. In some cases, maybe that condition related to excess growth hormone. Then there are rarer things like certain tumors or specific toxins like jasmine toxicity from the plant.
Wow.
And you always have to consider the simple possibility of a lab error, what we call factitious hyperphosphatemia. It's about considering all the angles.
So a lot of possibilities to weigh. What about the actual blood tests? What are they looking for besides just that high phosphorus number itself?
Well, the elevated serum phosphorus level, above 6 in cats, 5.5 in dogs generally, that's the primary indicator, of course. But the relationship between phosphorus and other blood values is really informative. For example, like we said, low calcium along with high phosphorus strongly suggests hypoparathyroidism.
Okay.
On the other hand, if calcium is also high, that might point more towards vitamin D poisoning.
Right. Different patterns.
Exactly. Then looking at the levels of other waste products in the blood as atemia and how concentrated the urine is, the urine-specific gravity helps us understand how well the kidneys are actually functioning.
Kidney function tests.
Yes. And in some specific conditions like hypoadrenocorticism or Addison's disease, we might also see characteristic changes in potassium and sodium levels. So it's really about interpreting the whole panel, not just one number.
And are there other specific lab tests they might run to help pinpoint the cause beyond the standard blood panel?
Yes, absolutely. Depending on those initial findings and the clinical picture, several other tests can be very helpful. Measuring the level of parathyroid hormone, PTH, in the blood can help figure out if the parathyroid glands are working correctly. Is PTH appropriately low or is it high, suggesting a different underlying issue?
Okay.
Checking thyroid hormone levels, like T4, is essential if hyperthyroidism is suspected in a cat.
Makes sense.
For that condition related to excess growth hormone, hypersomatotropism, measuring insulin-like growth factor 1 or IGF-1, can provide clues. We can measure vitamin D levels, but honestly, those assays aren't always readily available or easy to interpret sometimes.
Okay.
And if there's a suspicion of hypoadrenocorticism, Addison's, then a specific test called an ACTH stimulation test is needed to confirm or rule that out. So these more targeted tests really help narrow down the possibilities.
What about imaging, like X-rays or ultrasound? Can those help figure out why the phosphorus is high?
Imaging can definitely provide valuable pieces of the puzzle. Abdominal X-rays or radiographs can help assess the size and shape, maybe symmetry, of the kidneys.
See if they look abnormal.
Exactly. An ultrasound of the kidneys is often even better. It can sometimes detect mineralization, those calcium deposits in the soft tissues, which can be a consequence of long-term high phosphorus, or indicate other kidney problems. A thyroid scan might be used in cats to look for abnormalities in the thyroid gland, especially if a tumor is suspected. And X-rays of the bones, the long bones, can help identify signs of bone loss, osteoporosis, or even tumors that might be causing that excessive bone resorption we talked about. So yeah, imaging gives us a visual perspective.
And in some of those more complex or unclear situations, are there any specific procedures they might need to do to get a diagnosis?
Yeah, in certain cases, particularly if the kidney involvement isn't clear just from blood work and imaging, a kidney biopsy might be considered.
Biopsy.
Yes, it involves taking a very small sample of kidney tissue, usually with ultrasound guidance, to get a much more detailed look at its structure and function under a microscope. This can be really helpful in identifying the specific underlying cause of the kidney problem, if that's what's going on.
Okay, so they've diagnosed the hyperphosphatemia and hopefully figured out the why. Now, what's the plan for treatment? How do vets actually address this?
Right. Treating hyperphosphatemia usually means the animal needs to stay in the hospital, at least initially. Mostly because, as we mentioned, it can have serious consequences, especially acutely, and we need to monitor them very closely. Plus, they often need supportive care, like intravenous fluids.
Right.
In severe cases, it really is considered a medical emergency. Now, a fundamental part of treatment, pretty much regardless of the underlying cause, is restricting the amount of phosphorus in their diet long term.
Diet change.
Yes. And for 5E fluids, normal saline is usually the fluid of choice. We specifically want to avoid any fluids that contain phosphorus, like lactated Ringer's solution sometimes does.
Makes sense. Avoid adding more fuel to the fire.
Exactly. The primary goal of treatment is always twofold. Lower the phosphorus levels safely and address the underlying cause, whatever that may be.
And are there specific medications they might use to actively bring those phosphorus levels down?
Yes, there are medications used for both immediate acute situations and for longer-term management. For acute severe hyperphosphatemia, giving dextrose intravenously, often along with insulin, can be very effective pretty quickly.
How does that work?
Well, insulin helps move glucose, sugar, into the body's cells, right? And it also takes potassium and phosphorus along with it. So it effectively drives phosphorus from the blood into the cells, lowering the blood level temporarily.
Ah, okay. A temporary fix while you address the cause.
Exactly. And again, critical to avoid phosphorus-containing fluids during this. Now, for chronic hyperphosphatemia, the main medical treatment often involves oral phosphorus binder.
And binders.
Yes, medications like aluminum hydroxide or aluminum carbonate are common examples. These are given with meals.
With food.
Yes, they work in the digestive tract. They literally bind to the phosphorus that's in the food, which reduces how much of it the body can actually absorb. The typical dose is calculated based on body weight and given with each meal to catch the dietary phosphorus.
Okay, that makes sense for long-term control. Once they start treatment, what kind of follow-up and monitoring is needed? It sounds like things can change quickly.
They definitely can. Close monitoring is essential, especially early on. We need to check serum calcium levels frequently, often every 12 hours at first.
Why calcium so often?
Because as we successfully lower the phosphorus, there's a risk that calcium levels might drop too low, hypocalcemia. Remember that inverse relationship they sometimes have?
Ah, right. Balancing act.
It really is. We also need to keep a very close eye on kidney function. That means monitoring urine output. Are they producing enough urine? If they become oliguric, meaning very low urine output, that's a serious concern.
Okay.
And we need to continually assess their hydration status, checking their weight, maybe central venous pressure if they have a catheter, looking for signs of dehydration or even fluid overload, edema. It's a dynamic situation requiring careful attention.
And are there any potential problems or complications that can pop up during the treatment of high phosphorus? Things to watch out for.
Yes, definitely. One significant risk is, ironically, overdoing the treatment and causing the phosphorus levels to drop too low. That's called hypophosphatemia.
Low phosphorus.
Right. And that can actually lead to a whole different set of problems, including things like the breakdown of red blood cells called hemolysis. So you have to be careful not to overshoot.
Yeah.
Also, even with treatment, if the underlying cause of chronic hyperphosphatemia isn't well managed, that long-term issue of soft tissue mineralization, those calcium deposits, can still progress and cause further organ damage over time. So it really is a delicate balance and requires ongoing management.
This has been incredibly helpful, really clarifying. So just to quickly recap the main points for everyone listening. Hyperphosphatemia is when there's too much phosphorus in the blood of dogs and cats, with specific cutoff levels for each.
Yep.
It can be caused by the body absorbing too much, releasing too much from bones, or, probably most commonly, the kidneys not getting rid of enough.
That's the gist of it.
And it's linked to a whole range of underlying health issues: kidney problems, hormone imbalances, diet, even toxins or certain medications.
Right.
Diagnosing it involves looking at the clinical picture, doing blood work, focusing on patterns, not just the phosphorus number, sometimes using imaging or more specific tests.
Yep.
And treatment focuses on lowering phosphorus through diet, sometimes 5E fluids and meds acutely, and often long-term use of phosphorus binders.
Exactly. A very good summary. And for you listening, I think the key takeaway is to understand that while obvious signs specifically of high phosphorus might not always be present,
Yeah.
being aware of the risk factors, especially if your pet has known kidney disease, and recognizing that seemingly vague signs could potentially be connected to electrolyte imbalances like this, that awareness can really empower you to be a more informed and proactive advocate for your animal's health.
Absolutely. It's just amazing how interconnected everything is in the body, isn't it?
It truly is.
When you think about all the different systems involved in just keeping this one mineral, phosphorus, balance the digestive system, the bones, the kidneys, the whole hormone system, it really makes you wonder what other seemingly unrelated health issues might be influenced by even a slight imbalance in this mineral in our pets.
That's a great question.
It really makes you think about all the subtle signs we might be missing. Signs that could tell us a lot more about their overall well-being, maybe even in ourselves, too.